Alright, so in this video we're going to be covering the bones of our cranium. So if we look at a skull, the skull has two divisions. It has a cranial division that includes all the 8 bones that we'll be covering in this video. And the cranium is responsible for housing the brain. Then you also have a facial division which provides you all of the structures of your face. So we'll go ahead and begin. Here we have our frontal bone, and our frontal bone is basically just our forehead. So it's going to be our anterior aspect of our skull, and it also provides us the superior border of our orbit. Orbit is just a term for the eye socket. So the frontal provides our forehead and our superior border of our orbit. Now if you look very close here, you could see a little notch there on the superior border, and that hole is called the supraorbital foramen. So that is one of the features of the frontal bone, is the supraorbital foramen. Then if we look here at the top of the head, we see this suture. This is your coronal suture. And so this is where your frontal bone has fused with your parietal bones. So this is your coronal suture. Now if you look at the two parietals here, so you have a right and a left parietal. So this is a paired bone. So the two parietals are connected at the sagittal suture. Because sagittal means, remember that plane, sagittal means midline, or the separation into right and left. So that's your sagittal suture, where you find the two parietals fusing. And that's all you need to know for the parietal bones, is that just you have a right and a left one, and then between them is the sagittal suture. Now if we turn the skull around here, and we look at the inferior posterior portion of the skull, you find the occipital bone. So here's your occipital bone, and then the suture that is showing where the occipital has fused to the parietals, that is going to be known as your lambdoid suture. So this here is your lambdoid suture. Now there's a couple of things I want you to know about the occipital bone. So here's your occipital bone, and then if you turn the skull around and you look on the inferior portion of the skull, you see a very large hole. This is known as the Foramen Magnum. And this is where the spinal cord will travel from the vertebral cavity up into the Foramen Magnum to meet with the brainstem. You also notice these two bumps or ridges alongside the Foramen Magnum on either side. Those are called the occipital condyles. So here and here are your occipital condyles. These are the sites of articulation for the first cervical vertebrae, so also known as C1 or the atlas. So this is going to create your atlanto-occipital joint, which allows you to move your head up and down in a nodding motion. So that's your yes-yes joint. Moving on, we have our temporal bone. So your temporal bone is on the side here. So those are also, along with the parietals, your temporals are paired. So there's one on the right and there's one on the left. So you have your temporal bone here, the suture that shows the fusion of the temporal with the parietal on either side, that's known as the squamous suture. And this is because the temporal bone has a flat appearance to it, whereas most of the other bones have a dome-shaped. So they call it squamous because squamous means flat, and therefore this is your squamosal or your squamous suture. So a couple things I want you to know about the temporal. Here on the back, we have what's called the mastoid process. The mastoid process serves as a muscle attachment site, specifically for a muscle known as the sternocleidomastoid, but that's not necessary for your test. But just know that this is the mastoid process, and this is going to serve as a site of muscle attachment. Then we also have the little hole here, if you look close. That hole there is known as your external auditory meatus. So meatus is a little bit of a larger structure than a foramen. It's a canal. So unlike the foramen, we're not going to see blood vessels and nerves traveling through this canal. So what instead is going through the canal is all the structures of your ear. So this is your external auditory meatus, this little canal here. Then the other structure, the last structure I want you to know of the temporal bone, is your zygomatic process. So this one here, you can see this is your zygomatic process of your temporal bone. The zygomatic process of the temporal bone will fuse here, so you can see that suture line there. It fuses with the temporal process of the zygomatic bone. Okay, so here's your zygomatic bone, which makes up your cheekbone. It has a temporal process that articulates with the temporal bone, and your temporal bone has a zygomatic process that articulates with the zygomatic bone. These two processes, the temporal process of the zygomatic bone and the zygomatic process of the temporal bone, form the zygomatic arch. So the two processes form the zygomatic arch. So we have two more cranial bones to cover, and for these ones we will have to open the skull and look inside. Let's see. There we go. So this one kind of has some drawings on the middle, or on the inside. Don't worry too much about those. But you can see here these nice little winged structures here. So they're actually outlined in gray. So here we have this wing, then we have this wing towards the bottom, and so this whole structure, and along with the little portion in the middle, that's going to be known as your sphenoid bone. Let me actually switch out. So I'll use this one because we won't have the markings on the models for the practical. So you can see here, here's one wing, here's the bottom wing, and it kind of looks like either a bat or a butterfly, whichever you choose. And the sphenoid bone is very unique in that it acts as the keystone of the cranium. Now what I mean by that is that it basically articulates, well not basically, it does, it articulates with every single other bone in the cranium. So you can see it's articulating here with the frontal, here with the ethmoid, which we will cover shortly, here with your temporals on the sides, and then back here with your occipital. So your sphenoid is going to be the keystone of the cranium because it articulates with all the other cranial bones. And there's also another very important structure to it. So it's going to be this structure right here in the middle of the sphenoid. And that structure here is known as the sella turcica, which literally translates to Turkish chair. This structure here is basically providing a little safe haven for your pituitary gland. So this is where you will find your pituitary gland, is in the sella turcica of the sphenoid bone. Then we have our last bone, which I'll zoom in here a little bit. This is your ethmoid. So you can see the suture lines here. So this bone here is your ethmoid bone. Now there's a couple structures I want you to know for the ethmoid. The line that you can see coming straight down here in the center, the one that's coming out toward you, that is going to be your Crista Galli. The Crista Galli is an important structure because it's going to provide the attachment point for the dura mater. Now dura mater is just a membrane that's going to encase the brain, and so it's surrounding the entire brain and then coming around and attaching at this Crista Galli of the ethmoid bone. And that's basically allowing the brain to be anchored in place. Then we have on either side of the Crista Galli here, the areas that are dark and kind of shaded in there, that's going to be your Cribriform Plate. So here and here. That will be your Cribriform Plate, and on the Cribriform Plate you have what's called olfactory foramina. So foramina is just a plural term for foramen, and olfactory means smell. So the olfactory nerves that are coming from your nose will travel through the olfactory foramina in the Cribriform Plate of the ethmoid bone, and it'll go to the brain. The last part of the ethmoid bone that I want you to know, that you really can't visualize very well, but because it can't be visualized by the skull, but that's going to be your perpendicular plate. So you can see how the Crista Galli runs from basically anterior to posterior. So if I put the guy like this, my Crista Galli would be coming out of the screen at you. So that means if I want to make a 90-degree angle, I have to go like this. So that perpendicular plate of the ethmoid bone, as you can see, runs down to the nose. And it's basically going to provide you the superior portion of your nasal septum. The inferior portion, if you look in here, this bone that runs through the center of the nose that's providing the inferior portion of the nasal septum, that is called your vomer. It's one of the two non-paired bones of the face. So the vomer is included in the facial bones, not the cranium. So that concludes it. We had our frontal here, our two parietals, the occipital, the sphenoid here, and then our ethmoid, and then our temporals. So that concludes the 8 cranial bones.